Hi everyone, this is Dr. Ginger here. I am back with another orofacial video. For those of you who don't know me, I'm a physical therapist, but you can read a little bit in the links in the description. Let's get to the point. I have a lot of patients coming in that have pelvic health issues, or they could be coming top down. They have vocal and neck issues. So it could be bottom up or top down. I call that a 3 diaphragm approach. Now, regardless of which end you're coming in for, ultimately we have to treat the same things because they are connected. The laryngeal, oral, cervical, whatever diaphragm you want to call it in this area, the respiratory diaphragm and the pelvic diaphragm. So there's a condition I want to talk about today called globus pharyngeus. Not surprisingly, it has a medical gaslighting history. Hippocrates first noticed this about 2,500 years ago, and in 1707, approximately, this condition was originally described as globus hystericus because it was associated with menopause or other psychogenic factors, aka hysterical women. It was not changed until 1968 after discovering that, most patients aren't hysterical that have this issue. So maybe we should stop falsely associating the two and also attributing it to a mostly female condition. So lots of medical gaslighting going on for, last few thousand years or so. So let's strike that. A, yes, it can happen more to females, and B, it has nothing to do with anyone being hysterical whatsoever. What it does have to do with is, let's start with the primary factor here. I want you to turn your head, watch me, take 2 fingers on the opposite side and turn your head. Do you see the muscle that you can grab there? I'm going to go up a little, turn your head. Go all the way up to the last 1/3, which is right under the jawline. Turn your head. Do you see how easy that I can grab that and grasp it and then turn back? I still have it. Okay, that was called, sorry, I hit my desk a little. It was a little bumpy. It was called a strap muscle a long time ago. This basically it is like a strap muscle because if it's tight, you can see them. Now I've been touching my neck and it's red, but you can't really see the muscle other than the fact that I'm thinner. And so naturally, if you turn your head, you can see it, but it should never stand out that much when the head is straight forward. That is known to compress many structures, not just making beautiful sound and being able to voice, but also the C-spine. And it has a downward ripple effect, okay? So what can you do? Well, first of all, is just turning the head to be able to, you don't have to get under it necessarily, but I want to show you how easy it is to do soft tissue work. Just like this, all the way up. I'm just stabilizing it. I'm not grinding under with 2 fingers. Sorry, that's my dog. She must be involved in whatever's going on. Is just stabilizing it, not grinding and poking and all that. Just stabilize it so it doesn't move. And you can do massage all the way up. It runs from the bone behind the ear, and it has 2 heads that come down to here. Now, the other place that you can feel if it's tight is at the clavicle here, at the collarbone. So see where it comes in? You can see where it comes into here. Now I'm going to turn back so you can hear me a little bit better. That area right in here. Now, if I were to breathe incorrectly, do you see how the muscles stand out? Do you see everything kind of flashing in my neck, right? Even as I'm talking right now, because you can voluntarily turn those on, and we don't want that. But if I change my breathing, let me back up. If I change my breathing, and I just sit back and relax. Now notice when I lift my head, they come on. So keep your chin down. Improve my light situation, there we go. Keep your chin down, put your hand on your belly. Put your 2 fingers right here. Can you take an inhale? See my hand move? These muscles do not turn on. I don't expect you to master this by just trying it. I want you to go and lie down somewhere, okay? Lying down on your back, knees bent, feet flat, would take the pressure, the stress, the tensile force off the fascia that usually rests in the hip flexors that's connected to your respiratory diaphragm. So I want you to lay in that bent knee position, and then fingers here, preferably 4. If you can do it, which you could do here. And then hand on the belly. Now, I can just put my finger right over my collarbones here and feel both SCNs, but I'm not pressing down. Now, the belly should not just expand this way. I want your belly to expand out this way. It's going to feel a little bit different, but don't overbreathe. Don't go and really blow out your belly. That's not going to do great things for your bladder, not in the long run. So just make it a natural expansion. Don't overdo it. I'm getting about a 4 to 6 count inhale, and you see nothing contracting through here. And as I exhale, it's still all good. As long as I'm talking, it means I'm still exhaling. No tension. So that's what you want to feel. I want you to practice. So this is what I would have someone do. This isn't physical therapy, but I can talk you what I do with others. So if someone's practicing that, then I want this, the strap muscle here, that creates that globus pharyngeus lump in the throat, like there's a pill stuck there or something like that. That's what we're working on. Because the tighter the neck muscles are. Now, this isn't speaking about orofacial. Go and watch orofacial part 1 and 2 if you feel like this is tight. Now, this can also be tight. I mean, there are sections. I have to divide this stuff up, right? But for the neck, I want you to address, okay, this one could be one of the main ones that you address here, but it won't normalize until you normalize the breath, which is inhale. About 6 counts, right? Exhale. And there is absolutely, positively no tension. You can even see that I massage the side of the throat as I'm breathing. It doesn't change the quality of my voice. It doesn't hurt. It's not tight, right? And you can see when I'm inhaling that they're not doing anything, right? It's like watching paint dry. That's how masterful I want you to be with the breath. Now, see how I'm tensing here, right? You can see it, like if someone gets excited about something, do you see how the muscles can really stand out in their neck? That's not what we want. If you're animated, that's one thing. If you are recruiting all the muscles in your neck just to speak, not great. If you're recruiting them to sing, really not great. Or to project your voice at all. We want the power to come from the pelvis. And to do that, we need to master that breathing. So when you inhale, do you see how my belly goes 2 directions? It goes out, but also the side walls of the belly. Some people call that the rib cage, the obliques, whatever. Call it what you want it. This should expand, but also watch this hand. Which way does it go? I've got 2 things going on here. I've got this one on the inhale and that one on the inhale. So a really good party trick to get used to doing is just, without breathing at all, just expand the ribs and relax the ribs. And you do it with 0 tension in the neck. Expand, relax, just like that. You might have to associate it with the breath initially, right? Of inhaling, exhale, hold it out there, and then let it go. So that teaches you how to better control your breathing and become more masterful at breathing. That is not done in the 10-minute video that you're about to watch here. That's done over weeks and months, where you become this breath becomes effortless. So you breathe without the assistance of strap muscles, the sternocleidomastoid. You'll notice that with looking, right? Do it in front of a mirror if you need to, or by palpating here. You're going to be able to master a 6-count inhale and a 6-count exhale, and you're going to get expansion here and here at the same time. So when I inhale, this happens. But I don't want the ribs to expand this way, not that way, only this way, okay? So inhale, ribs go to the side, not to the front. Inhale, belly should go, this way, right? You're also going to get some expansion in the back ribs, so the back ribs can flip up, but I really don't want the front ribs to flip up, okay? So quick recap. 6-count inhale, 6-count exhale, lying down, knees bent, feet flat. 0 tension in the SCM, the strap muscles. If you do, catch them, massage them out. Also, come see an orofacial physical therapist. Some speech language pathologists will also deal with this, but they won't be able to deal with the rest of the pelvic floor stuff. So we all work together as a team. So SLP, PT, and OT might also specialize in orofacial treatment. So come seek one of us out if it's something that you really can't handle and you can't master, because it would be a red flag if you can't master it. And you want to be able to do that, inhaling and breathing, right? With belly expansion this way, no rib expansion this way, and rib expansion this way. So like that, as you breathe with no tension. Okay, good luck. Hopefully this will be as helpful to you as some of the other videos that you guys have said are helpful. I'm doing this video based on request from you guys, so enjoy, and don't forget to subscribe, and do share a video with a friend if it is helpful, because that just helps other people out too, and that's why we're on the planet, is to help each other.